One of the earliest methods ever devised to replace missing teeth is a device called a removable partial denture, and these are still done today. A removable partial denture is a device, it's one prosthesis, and that prosthesis replaces all the missing teeth that someone has in that arch. The only advantage of removable partial dentures is that they're the least expensive method of tooth replacement, but they're fraught with problems. First, the partial has a metal piece which covers the palate. For most people, that the piece of metal or plastic covering their palate is both annoying and inhibits their enjoyment of food. So after you get done eating with a partial denture, most people need to excuse themselves, go to the bathroom, take out their partial, rinse out their mouth to get the food particles, and put the partial back in. Another disadvantage of a partial denture is that a partial denture uses clasps to attach to the teeth. That's how it's held in. And over time, those clasps twist the teeth and loosen the teeth. In fact, we know that when we replace teeth with a partial denture, the teeth that the partial denture clasp onto are at a much greater risk of being lost than if we had never placed a partial denture in the first place. The clasps wear on the teeth, they can get decay, or they twist the teeth. When a tooth is removed, we rock it back and forth until it finally comes free from its socket. In effect, a partial denture rocks that tooth day in and day out until eventually it comes free from its socket. And that's many times why teeth are lost when people wear partial dentures. So people will make the trade-off to wear a partial denture because they want some type of tooth replacement, but in the long run, they're robbing Peter to pay Paul because it only results in greater loss of teeth.